Welcome to Unit 7, Lesson 3. This is part 2 of the video. This is optional unless you've missed class. If you have missed class, we went through and drew this drawing in class, and I've just gone back and drawn it here. So I would pause the video at this point and take a minute or two to draw out this heart to the best of your ability so we can trace blood flow through the heart. Okay, so hopefully you've done as I suggested and you've gone and drawn this heart, and you're now back waiting to see how blood flows through it. So blood flow through the heart, even though it's a cycle, we typically start at the right side of the heart, and you can remember it as RAV, LAV. So right atrium to right ventricle through the lungs, and then back left atrium through left ventricle. And just recall, this is the right side. And basically, they trace the pattern, even though it's a cycle and you could start anywhere. They start the way we read in the top left corner, which in reality is the right hand side of the heart. Okay, so we're going to start with the right hand side of the heart, which collects deoxygenated blood coming down from the head and into the right atrium, and coming up from the body again into the right atrium. So from the head, that's your superior vena cava, and from the bottom it should be your inferior vena cava. So that comes into your right atrium. It is then pumped from the right atrium into the right ventricle. And to get into the right ventricle from the atrium, it has to go through this one-way valve. Prevents blood flow from going back up into the atrium. That one-way valve is called the AV valve. AV for atrioventricular valve. The blood then proceeds out of the right ventricle, up through another valve, which is called the semilunar valve. Okay, into what's called the pulmonary trunk. I'm just going to write trunk here. And out to the pulmonary, because it's taken away from our heart. Is it going to be a vein or an artery? If you said artery for away, you are correct. And you have the right and the left going to the right and the left lung. So 2 lungs. When the blood gets to the lungs, it will become oxygenated, and we'll bring it back in 2 vessels that run behind the heart, hence why this is drawn a lighter gray, from the right lung and coming back from the left lung. These are your left and right. In this case, we're on our left, so left pulmonary, and because it's bringing it back to the heart, veins. It then comes into the left atrium, and then it's pushed down into the left ventricle, again. It's going to go through the valve here. This is also called an AV valve because it's separating the atrium and the ventricle. blood will then proceed back up out of the left ventricle into the aorta, which will wrap down behind the heart, as well as branching off to the head and arms and down to the body, taking oxygenated blood to the body. And of course, you see there's one more valve. The idea of the valves is so that the blood can only flow in one direction during the pump, and that one is also called the semilunar valve, or sometimes the aorta valve. Okay. An important thing here is, the left side of heart is typically more muscular because it has to pump all the way to the body. Whereas the right side less muscular because it pumps to the lungs. And because they're pumping to different sides of the body, the right is what we call the pulmonary circuit, carrying deoxygenated blood, whereas the left is the systemic circuit, carrying the blood to your body. Okay? So, let's look at how your heart actually pumps this blood through using the heartbeat. And it is referred to, we'll zoom in here, referred to as the cardiac cycle. Okay. The heart functions as a double pump where it's mentioned above, left side pumps to body. What did we call that again? The blank circuit, systemic. And the right side pumps to where? To the lungs, which we call the fancy word for lungs, agreed pulmonary circuit. Okay. But when our heart pumps, let me just draw a little picture of our heart. The important thing is, if we have our heart like this, even though they pump to different sides, it does not beat right versus left. Okay? Remember, the atria are the circular ones up at the top, and the ventricles, the V shape, goes in the bottom where the heart is shaped like a V. And what happens is your atria contract together, and then your ventricles contract together. Okay, and when you hear the what's called the luped up of your heartbeat, the lub is actually your AV nodes snapping shut. And the DOP is your semilunar valves closing. Okay, just to backtrack and correct something I said here, not your AV nodes, your AV valves. Okay, there are AV nodes we're going to talk about, but your AV valves closing. So as they close, they make this little slup sound. Okay. So each cardiac cycle is as follows. In step 1, right and left atria contract in what we call atria systole, or systole, depending on who's pronouncing it. I'm not going to say the E's. So systole means to contract, and first the atria contract together, and then the right and left atria relax. And this is called atria diastole. And then, almost coordinated with the relaxation, sort of overlapping, the right and left ventricles contract. This is ventricle systole, or systole, which equals the top number of blood pressure reading. So if you're measuring your blood pressure in your brachial artery in your arm, you're actually measuring the top pressure you reach due to ventricle contraction. And then we have right and left ventricles relax, which is what we call ventricle diastole. And equals the bottom number of BP reading, blood pressure reading. BP for blood pressure. Okay. Now your heartbeat, the actual rhythm of your heartbeat, can be controlled by the heart itself or by the nervous system. So when you watch those horror movies or cartoons where someone reaches in and grabs out a heart and it's beating outside the body, that is theoretically possible. It won't do it for very long because it doesn't have enough blood supply, so the tissues will start to die. But it is capable of beating independent of the brain. So the heart is capable of regulating its own heartbeat independent of the brain. Hence the term intrinsic control, as intrinsic means within, and it's being controlled within the heart. So we're just going to zoom out a little bit here so we can draw a picture. What you can do is draw a relatively large heart, and then you're going to draw a half heart, leaving some space, because what we want to leave is indication of the muscle tissue. Those are the valves, and then we have the vessels that come out top. Okay, and that's enough detail for what we need to draw. So, first thing we have, and draw them in blue, not to represent deoxygen. Actually, I'll draw them in purple. I'm trying to find a color that we haven't used often, but we'll draw them in blue. It's not to represent oxygen or deoxygenated. It's just to represent some tissue. And in your right atrium, you have two very important tissues called nodes, which are a mixture of nerve tissue and muscle tissue. Okay, I'm going to zoom in a bit here. We're going to label and talk about what these nodes do. So up near the top, you have what's called the sinoatrial node, which is also nicknamed the SA node. And it contains nerve and muscle fibers. It is nicknamed the heart's pacemaker because independent of the brain or the nervous system, it controls heartbeat so that you have 80 beats per minute. Now if it goes up or below 80 beats a minute, it's usually your nervous system is controlling it. And it does this spontaneously. So it spontaneously initiates the heartbeat. And causes the atria directly to contract. Indirectly, it causes the ventricles to contract. So what happens here, and we're going to use orange for an electrical signal. It initiates an electrical signal that spreads throughout the atria, causing the atria to contract from top to bottom, and it goes across and causes the left to contract at the same time as the right's contracting. At the same time, this signal travels to our next node. So our next node is called the atrio, all one word, just the hyphen for the space on the page, ventricular node, or nicknamed the AV node. And what it does is it collects the electrical signal and passes it on to the AV bundle, atrioventricular bundle. And the AV bundle is a set of nerves that run down the middle of the septum. And the interesting thing is, when these nerves are carrying the electrical signal, they don't directly cause muscle contraction, unlike the nodes. And the reason for that is if we were to contract the muscle as the electrical signal traveled down the septum, we would be squeezing the ventricle from the top to the bottom even though the route out of the ventricle is up at the top. This is kind of like trying to leave the lid on a toothpaste tube and squeezing it really hard. It's going to burst. If you do this to the heart, it also will burst. So instead, it picks up the electrical signal and without causing direct contraction, carries it down the AV bundle. The AV bundle then hooks up to nerve fibers called Purkinje fibers, which then cause the contraction of the ventricle from bottom up so that the blood can be forced out the top of the ventricle, so out the arteries. So this electrical signal will be carried along these Purkinje fibers, causing contraction from bottom to top. So this here is the AV bundle. Carries electrical impulse to bottom of ventricle. Okay. And Purkinje fibers. Which the Purkinje fibers then cause ventricles to contract from the bottom up. Okay, so if we were to look at how this affects blood, the blood comes into the atria, and then the SA node causes contraction of the atria from top to bottom, forcing the blood this way. The AV node picks it up, carries the electrical signal down the AV bundle to the Purkinje fibers that then contract from bottom up, causing the blood to go up and out of the ventricle. So down the atria, up the ventricle. And it's going to do both atria together at the same time, and then both ventricles together at the same time. So that's the intrinsic control. But we can alter our heart rate quite drastically depending on our fitness, our situation, whether we're stressed or not. So the heart rate can be controlled externally, not external to the body, but external to the heart, by the nervous system. Hence, extrinsic. Extrinsic because it's outside of the heart. Okay, so what we're going to draw here, I'm going to zoom out even a little bit more. I'm going to draw a head. With the brain. Cerebellum, the brain stem with the pons coming down like this. Okay. This person's going to have fairly broad shoulders. Just give us space to write everything. And down here the heart. Again, a very large heart, and in that heart it has a sinoatrial node and it has a AV node. Okay, the important part up here, I'm going to zoom back in here. Is here, this is my pons, my brain stem, and below the pons, we should remember, is our medulla oblongata with what's called the cardiac control center. Which can send signals controlling our heart rate. Okay? And in the case of a parasympathetic signal, we send a signal down to each node. Okay? So in a parasympathetic response, is our heart rate increased or decreased? Are we under stress or are we relaxing? If you said relaxing and decreased heart rate, you are correct. And what happens is it causes the vagus nerve, not the city vagus, VAGUS, the vagus nerve, to release what neurotransmitter? If you said acetylcholine esterase, you are correct. Sorry, acetylcholine, not the enzyme, acetylcholine. So it causes the nerve to release acetylcholine, and the SA and AV node to decrease activity and thus heart rate. In contrast, we have a sympathetic response. We will send a signal to our nodes, causing them to increase heart rate. So sympathetic causes accelerator nerve to release what neurotransmitter to increase heartbeat? He said norepinephrine. You are correct. To cause SA and AV node to increase heart rate. Okay. So one last thing specific to the heart that we're going to look at right now is an electrocardiogram. And some of you may have had to have this. It's a test. Electrocardiogram is a recording of the electrical activity of your heart. And the neat thing is, because our body is mostly water and conducts electricity well, you can place electrodes on skin surface to detect the atrial nerves depolarization and the ventricle nerves depolarization and repolarization. And if you have a second to think about this and suddenly go, well, what about the atrial nerve repolarization? The electrodes can detect it, but the problem is it's occurring at the same time as the ventricle nerves are depolarizing, so the signal is masked by the depolarization of the ventricles, which is a much stronger impulse than the repolarization of the atria. Okay. So if we look at it, this is a classic wave for a heartbeat, and it has three main sections: the P wave, what is called the QRS complex, and then the T wave. And the P wave is looking at depolarization of the atria, which equals atrial contraction. The QRS is looking at the depolarization of ventricles, and thus the ventricle contraction. And the reason this electrical signal is so high is just because you have a lot more fibers depolarizing at once, because the ventricles have to pump harder because they send the blood further away. Atria, they just have to pump it downhill into the ventricles right below it. And then we have the T wave, which is simply the repolarization of the ventricles. And somewhere hidden behind that QRS wave is the repolarization of the atria. And if you have a normal heartbeat, most people's normal heartbeat is around 80 beats per minute. And if it's fast, you'll be able to see it. The peaks are closer together. And if you've watched any sort of program where they've had a patient hooked up to a heart monitor, you'll know it goes beep, 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 faster, beep, 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 slower, beep, beep. And the one you don't want to hear is the beep, because that means you've flatlined, there's no electrical activity in your heart. The slower heartbeat, of course, in the diagram, the peaks are further apart. And the last one that is a concern, often if you have heart problems, they tend to appear as a teenager. And some of you, this is why some of you might have had electrocardiograms just to check your heart rate, is if you have a regular heartbeat, sometimes what happens is what's called atrial fibrillation, where it's not beating at the proper rate. It's irregular, inconsistent. And this sometimes also happens to athletes when they get their heart level up, their heart rate up. So if you go to a lot of sports complexes, you'll find they have a sticker on their entries, on their door, that says that they have what's called a defibrillator. I'm pretty sure our school has one, because we did have a few years back a student who went into atrial fibrillation. And fortunately, the PE teachers knew how to do CPR and were able to do CPR until the ambulance came. But now I believe we have a defibrillator. So a defibrillator basically electrically stimulates the heart to try to reset the beat, shock it back into correct rhythm. Okay, so now we're just going to look quickly, not spend a lot of time, at some stats regarding our health, cardiovascular health in Canada. So every 7 minutes, someone in Canada will actually die of heart disease or stroke, and it accounts for approximately 30% of all deaths in Canada. 54% from heart disease, about 20% from stroke, and 23% from a heart attack. And it costs the Canadian healthcare system $20 billion per year. Now, the reason this is such a big number and these numbers are so relevant is most heart disease / cardiovascular, so not just in the heart but in the vessels, diseases are preventable. Unfortunately, a lot of people have at least one risk factor for cardiovascular disease, many of which they can prevent, such as smoking, alcohol use, inactivity, obesity, and high blood pressure, high cholesterol, and diabetes are often triggered by the above. But if you have any of those signs, you are at risk for having cardiovascular disease. So cardiovascular disease refers to any disease that affects the heart and blood vessels of the cardiovascular system. And perhaps one of the most common ones is what's called athersclerosis. So athersclerosis is the buildup of fat and cholesterol within the cell walls of the blood vessels. They're called plaques. A lot of people think they build up inside the vessel. They're actually built up in the wall. So here's a wall and here's the tissue, and it's between the walls or within the walls. Probably better to say within the walls. It's built up within the walls. And this has a lot of different negative impacts on our cardiovascular system. It increases our blood pressure because there's less room for the blood to flow through. Sometimes it causes a clot because as the blood slows down and it can't flow through, it starts clotting there. And the clot will block blood flow. And if it's to the heart, you will get a heart attack where you damage the tissue, the muscle tissue of your heart. And if it's to the brain, you will get a stroke. Sometimes these blockages or clots, they actually break off or move, and then they get caught when they move from like an artery into an arterial and cause a blockage there. So what they're showing right here is a heart that has a blockage so that it's not getting blood to the muscle of the heart. So here's some complications associated with high blood pressure. High blood pressure is an indicator that something's going wrong in your cardiovascular system. And when it gets blocked, you can have what's called a cerebrovascular accident, which is just a fancy word, a CVA, fancy word for a stroke. Okay? If you're just getting some lack of oxygen to the brain, you can suffer confusion, headaches, and convulsions. Okay? Of course, you can have a heart attack where your tissue of your heart's failing. You can get elevated blood sugar levels, and your kidney can actually fail to function because of improper blood pressure. Now, one of the ways we fix these blockages to our heart is called angioplasty. And it's not necessarily always to our heart, but it's most common, used to clear athersclerosis or plaques in heart. What they usually do is they go in through a major vessel in your leg and they trace all the way up to the heart with basically a very, very fine wire that has a balloon attached and a camera attached. And when they find the blockage, they inflate the balloon to basically pack down the plaque. The downside of this approach, though, is it's not a permanent fix. These plaques can continue to build up if there's not an adjustment to diet and why they're building up in the first place. And the other thing is, very occasionally when they're doing this, they actually cause the plaque to break off, and then it can move elsewhere in the body and cut off blood flow elsewhere in the body. So it is somewhat dangerous. If you're in a situation where it's too blocked to fix that way, the other thing they can do is they can do what's called a coronary bypass surgery. And what they do is they usually take a major vessel from your leg that you can afford to live without, because you have lots of vessels in your leg. And if this is the buildup, maybe the blockage is there. Okay. So you've got a buildup of plaque underneath. Excess cholesterol and fat is building into your vessels. Then what they will do is they will actually bypass. Now, if you want to think about this, in Kelowna, West Kelowna, just after they opened the overpass to the new theater there, and it crumbled, then they had to bypass that route because you couldn't use that route anymore, and they put in that new little road down by the First Nations, West Bank First Nations building there, to bypass temporarily until they could fix it. Well, what they do in coronary bypass surgery is they take a vessel out of your leg and they basically seal off, tie this off so it can't break or go anywhere, and then they cut into here, cut on the other side of where they've sealed, and then they attach the new vessel. And you've probably had grandparents or people you know, maybe unfortunately even parents who have had this. My grandmother had a triple bypass last year, and now the blood flows through the bypass, around the blockage, and back to where it's supposed to go. It's really quite a theoretically simple surgery and brilliant surgery, but there's a lot of risk when you have to crack through ribs and get in and handle the heart. Definitely preferable. Control your diet, be aware of your health risks, and if there's any family history, and avoid this altogether. Triple bypass just means they're going to be bypassing in 3 spots, quadruple in 4 spots, and so forth. Okay? And just as I mentioned above, and I put it down here in case you were unsure, when we have cerebrovascular accidents, CVAs, that just refers to a stroke. And this is either where blood flows to the brain is cut off by a blockage or due to a rupture. So that's another downside. When the blood pressure fills up here, it starts building up because of the blockage. Sometimes you will get a bulge out of the vessel, so it will start to bulge and it will weaken, and this can burst. It seems to happen in the brain more frequently. It can burst behind the blockage. That should be the vessel. And then you get a bleed. And in the brain it's called a brain bleed, or a CVA more technically. Okay, so that's the end of that lesson. If you have any questions, please come see me. Otherwise, I hope you have a great day, and I'll see you in class.